Hi, good afternoon. I'm Dr. Leslie Wakefield, pelvic floor physical therapist and owner here at Wellsprings Health. This week's Lunchtime Live, I will be answering the question, what is urinary frequency? Why do I have to pee all the time? It's the most frustrating thing. You feel like you just went 2 seconds ago and your bladder's directing you back to the bathroom again. The bladder should function as part of the whole system. It shouldn't be calling the shots, but for some people, they have a really disturbing sensation of needing to go to the bathroom frequently. Some people think that's normal. Some people realize it's a problem. Let's talk about what is normal first. Some of that depends on your hydration. There's a lot of people these days that are drinking a lot of water, which is wonderful. If you're drinking a ton of water, you might reasonably need to go to the bathroom every 2 hours or so, and that's okay. But in general, you should be able, if you're generally well hydrated, sipping water throughout the day, not chugging large amounts in any one setting, you should be able to go several hours without an uncomfortable urge to go to the bathroom. If you're having the need to go to the bathroom every 20 minutes, 30 minutes, 1 hour, I would classify that as urinary frequency. There's two main reasons why this happens. One would fall more into the category of bladder training. Your bladder's like a little puppy dog. You can train it to need to go every hour. You can train it to need to go every 3 hours. That is a real thing. I'll talk about that more in a minute. So there's bladder training, but then there's also pelvic floor dysfunction on the other hand. That's not something that you've conditioned your bladder to do through habit. That's a true dysfunction of the pelvic floor that's causing incorrect communication between the bladder and the pelvic floor and leading to feeling like you need to go more often than you really do. So let's talk about the first one, which is bladder training or bladder habits. You know, if you get a new puppy and the puppy's not house trained yet and you have to start teaching the puppy to hold its urine for longer. And so you go on intervals and maybe you start with every 30 minutes taking it out and then every 40 minutes and every hour and a half. And the puppy learns to hold urine longer. And I know it's such a silly comparison, but we kind of train the bladder the same way. If you are always, every time before you leave the house, going to the bathroom just in case, and then every time you're at the gas station, nobody likes to go at the gas station, let's just imagine. Every time you're at the gas station going again, just in case, and then you get to the office, you're like, well, I should go before I go to my meeting, so then you go again, just in case. And then after your meeting, you know that you're about to have to take a long drive to, I don't know, I'm making things up. You get it. If you're going more often than you actually feel the urge, you're going to condition your bladder to have a sensation of fullness early. So eventually, it's not really going to be your choice. Your bladder is going to tell you, well, we just went an hour ago, we better go again, just in case. There's some people, they have what's called lock-in key urgency. They're doing just fine in the car, but every time they get to the house, they're putting their lock in the key, turning, all of a sudden they have to go. They really, really need to go. There's other people that get a sensation of urgency every time they're about to go into the bathroom. All of a sudden they feel like they have to go right now. Some people will feel the need to go every 20, 30 or minutes or even every hour. And it's because they've conditioned this muscular bag. Your bladder is a muscular bag. It's called the detrusor muscle. And it's been conditioned to go at a certain frequency. You condition your muscles to do all kinds of things. You can condition your muscles to run a marathon. You can condition your bladder to hold for longer. And so if you're making a habit of going very frequently, at a certain point, it's not really going to be your choice. It's going to be your bladder calling the shots. The way we work with that is called bladder training, and we'll put you on a schedule. We'll look at your fluid intake. We'll look at your current habits. We'll make sure that you're actually urinating with a full bladder. We have ways to determine that. And then we'll get you on a schedule. All right, well, this week we're gonna hold just a little bit longer, and instead of going every 30 minutes, you're gonna hold for 45. And then we're gonna get your bladder comfortable with that kind of frequency. And then maybe the next week we're gonna up it to an hour and a half. It's just like going to the gym for any other muscle, but we're reconditioning the bladder muscle to be able to hold for longer comfortably. So that's an issue of bladder training. Another reason that someone might feel urinary frequency, feeling like they have to go all the time, is if the pelvic floor is running tight. Some people have a tense pelvic floor. So you might hear it called a hypertonic pelvic floor, a tense pelvic floor, a tight pelvic floor, a spastic pelvic floor. In general, it's just a tense muscle, but if your pelvic floor is holding extra tension, holding extra tone, your bladder is going to be responding to that inappropriately. What should be happening is this reciprocal relationship between the muscular bag of your bladder, imagine that's a muscular bag, and the pelvic floor and the holding the urine in. When the pelvic floor contracts, this muscular bag should get the message to relax. Don't squeeze. We're holding. So, okay, the muscular bag relaxes. Then when the muscular bag is ready to squeeze the urine out, the pelvic floor should relax and permit the pee out. So when the detrusor muscle, the bladder, is contracting, the pelvic floor relaxes to permit the pee out. And when the pelvic floor contracts, the detrusor muscle relaxes to stop squeezing urine. When one is contracted, the other should relax. When the pelvic floor is chronically tense, that communication gets interrupted. The bladder is not getting correct feedback. It's getting feedback that the muscles are tense all the time. So it stops listening. Honestly, it just gets on its own program. It gets out of this really useful feedback loop of being able to be regulated by the pelvic floor tension, and it just gets on its own program, and it's going to go whenever it feels like it. And a lot of people that have been classified as overactive bladder, OAB, we actually find that the real problem is pelvic floor tension, because they're running around clench in their pelvic floor, whether it's stress, whether it's pain, whether it's postural habits, whatever the issue there is causing that extra tension in the pelvic floor. It's disrupting the normal relationship that the pelvic floor should have with the bladder, and that inhibitory effect that the pelvic floor should be able to have on the bladder. The bladder goes off and does its own thing, and you end up feeling like you have to pee all the time. It's completely outside of your control. The bladder is completely controlling all the shots, running the show. It's in charge of the whole ship, which it shouldn't be. Everything should be working together. Your bladder should not be running your life. And I can tell you, there are people, you might be one of them, I don't know, but there are people whose lives are completely regulated by this one little organ in their body, their bladder, that tells them what to do and when to do it and how long they can do things for, because they have to know at every stop along their day, at every corner of their office and their favorite grocery store and the mall, where are all the bathrooms, because the bladder is completely controlling their life. And that's not reasonable. You shouldn't have to live that way. Whether it's an issue of a tense pelvic floor that has messed up the communication with the bladder, or it's an issue of just bladder habit, that muscular bag, it has a muscle memory, and that muscle memory currently is not what it ought to be. We can work with both of those with pelvic floor physical therapy. So let's do a little recap. The question was, what are some reasons that someone might have urinary frequency, the feeling of having to go all the time, something like overactive bladder, which is urinary frequency with urgency. And I gave two options. One problem might be bladder training. The bladder is actually a muscular bag. It has a muscular memory, just like muscle memory anywhere else in the body, and it can get in particular habits and set patterns, which we can adjust. We can work with that. We can train that to be able to hold urine for longer and not have sudden sense of urgency. The other issue might be a tight pelvic floor, a tense pelvic floor, so that the communication between the bladder and the pelvic floor, that inhibitory effect that the pelvic floor is supposed to be able to have on the bladder to cause the bladder to stay relaxed, is no longer working. And now the bladder is just off on its own neurologic program, doing its own thing, completely inappropriate, telling you that it has to pee. So those are the two options. I hope this was helpful. If you liked it, please like. If you would like to see more, please follow. I will post this to YouTube for replay later if you like. And otherwise, I'll see you next week.